Hello, everyone. If you can't answer these 50 essential body system questions, you aren't ready for the CNA exam yet. We've pulled the most frequent questions to make sure you pass on your very first try. Let's see how many you get right.
Question 1. Which of the following conditions is caused by a fungal infection? A. Psoriasis. B. Ringworm. C. Eczema. D. Rosacea. Correct answer, B. Explanation. Ringworm is caused by a fungus and spreads through direct contact or contaminated surfaces. It typically appears as a red circular rash with itching, unlike the other options, which are non-infectious skin conditions.
Question 2. Which is the largest organ in the human body? A. Liver. B. Heart. C. Skin. D. Lungs. Correct answer, C. Skin. The skin is the largest organ because it covers the entire body and protects against infection, injury, and fluid loss.
Question 3. A resident being treated for a skin infection suddenly develops an elevated body temperature. What is the CNA's most appropriate action? A. Apply a cold compress to the affected area. B. Give the resident extra fluids without reporting. C. Report the change in temperature to the nurse immediately. D. Document the finding at the end of the shift. The correct answer is C. A fever can indicate that an infection is worsening or spreading. A CNA must promptly report abnormal findings to the nurse rather than treating the condition independently or delaying documentation. Question 4. What is the main role of red blood cells in the body? A. Fighting infections. B. Carrying oxygen. C. Producing hormones. D. Aiding digestion. Correct answer, B. Red blood cells contain hemoglobin, a protein that binds oxygen in the lungs. This oxygen is then transported through the bloodstream to supply body tissues and organs with the oxygen they need to function. Question 5. Which body system is responsible for carrying deoxygenated blood back to the lungs? A. Respiratory system. B. Digestive system. C. Cardiovascular system. D. Nervous system. Correct answer is C. The cardiovascular system, consisting of the heart and blood vessels, pumps deoxygenated blood from the body to the lungs for oxygenation. The respiratory system handles the actual gas exchange, but the blood transport is done by the cardiovascular system. Question 6. Which hormone primarily controls the body's metabolism? A. Insulin. B. Estrogen. C. Thyroxine. D. Adrenaline. Correct answer, C. Thyroxine. Produced by the thyroid gland, regulates the body's metabolic rate, controlling how quickly cells convert nutrients into energy. Insulin regulates blood sugar, estrogen controls reproductive functions, and adrenaline prepares the body for stress responses. Question 7. Which of the following is not a function of the skeletal system? A. Protecting internal organs. B. Producing blood cells. C. Giving the body shape and support. Or D. Removing waste from the blood. Correct answer is D. The skeletal system provides structure, supports movement, protects organs, and produces blood cells in the bone marrow. Waste removal is the job of the urinary system, not the skeleton. Question 8. What is the main role of the alveoli in the lungs? A.
exchanging oxygen and carbon dioxide. B. Filtering dust and particles from the air. C. Producing sounds for speech. D. Breaking down food. Correct answer is A. Alveoli are tiny air sacs in the lungs, where oxygen moves into the blood and carbon dioxide is removed. They are essential for breathing, while filtration, voice production, and digestion are handled by other organs. Question 9. Which structure sends messages between the brain and the rest of the body? A. Lungs. B. Kidneys. C. Spinal cord. D. Heart. Correct answer is C. Explanation. The spinal cord transmits signals from the brain to the body and back, enabling movement and sensation. Lungs, kidneys, and the heart perform other functions and are not part of the nervous system. Question 10. Which body system protects the body from injury and helps regulate temperature? A. Integumentary system. B. Muscular system. C. Skeletal system. D. Nervous system. Correct answer is A. The integumentary system, which includes the skin, hair, and nails, acts as a barrier against injury and infection. It also helps control body temperature through sweating and blood flow regulation. Question 11. What is the main function of the respiratory system? A. Pumping blood throughout the body. B. Exchanging oxygen and carbon dioxide. C. Breaking down food for energy. D. Producing hormones. Correct answer is B. The respiratory system brings oxygen into the body and removes carbon dioxide through the lungs. Other systems, like the circulatory or digestive system, handle blood transport and nutrient processing. Question 12. Which part of the brain controls essential functions such as heartbeat and breathing? A. Cerebellum. B. Cerebrum. C. Medulla oblongata. D. Hypothalamus. Correct answer is C. The medulla oblongata, located in the brainstem, regulates vital involuntary functions like breathing, heart rate, and blood pressure. The cerebellum coordinates movement. The cerebrum handles thinking and memory, and the hypothalamus controls hormones and body temperature. Question 13. Which organ system removes waste products and helps maintain the body's fluid balance? A. Digestive system. B. Respiratory system. C. Urinary system. D. Circulatory system. Correct answer is C. The urinary system, including the kidneys, ureters, bladder, and urethra, filters blood to remove waste and excess fluids, maintaining fluid and electrolyte balance. Other systems serve different functions like digestion, gas exchange, or blood transport. Question 14. What is the process called in which rhythmic muscle contractions move food through the digestive tract? A. Segmentation. B. Peristalsis. C. Absorption. D. Filtration. Correct answer is B. Peristalsis is the involuntary wave-like contraction of smooth muscles that pushes food through the esophagus, stomach, and intestines. Segmentation mixes food, absorption takes in nutrients, and filtration occurs in the kidneys. Question 15. Which hormone helps regulate blood sugar by allowing cells to absorb glucose? A. Insulin. B. Glucagon. C. Adrenaline. D. Thyroxine. Correct answer is A. Insulin, produced by the pancreas, lowers blood sugar by enabling cells to take in glucose for energy or storage. Glucagon raises blood sugar, adrenaline triggers the fight or flight response, and thyroxine regulates metabolism. Question 16. Which blood vessel carries oxygen-rich blood from the heart to the body? A. Pulmonary artery. B. Pulmonary vein. C. Aorta. D. Vena cava. Correct answer is C. The aorta is the main artery that transports oxygenated blood from the left ventricle of the heart to the entire body. Pulmonary arteries carry blood to the lungs. Pulmonary veins bring oxygenated blood back to the heart, and the vena cava carries deoxygenated blood to the heart. Question 17. Which condition is characterized by weakened bones that are more likely to break? A. Osteoarthritis. B. Osteoporosis. C. Scoliosis. D. Rheumatoid arthritis. Correct answer is B. Osteoporosis causes bones to lose density and strength, increasing the risk of fractures. Osteoarthritis affects joint cartilage. Scoliosis is a spinal curvature, and rheumatoid arthritis is an autoimmune joint disease. Question 18. The process of physical and chemical breakdown of food so it can be absorbed by the cell is called A. Excretion, B. Metabolism, C. Digestion, D. Respiration. Correct answer, C. Digestion. Digestion breaks down food into smaller molecules that cells can absorb and use for energy and growth. Excretion removes waste, metabolism involves chemical reactions in the body, and respiration exchanges gases for energy production. Question 19. Which body system is responsible for producing hormones that regulate body functions like growth and reproduction? A. Immune system. B. Lymphatic system. C. Nervous system. D. Endocrine system. Correct answer, D. The endocrine system produces hormones that control growth, metabolism, reproduction, and other body functions. The immune system defends against infections. The lymphatic system manages fluid balance. And the nervous system transmits signals throughout the body. Question 20. As a person ages, which of the following is a normal change in the circulatory system? A. Heart muscle becomes stronger. B. Heart rate increases at rest. C. Blood vessels become less elastic. D. Blood flow to the brain increases. Correct answer is C. With aging, arteries and blood vessels naturally lose elasticity, which can increase blood pressure and reduce circulation efficiency. Heart muscle strength usually decreases, resting heart rate remains fairly stable, and blood flow to the brain may decline rather than increase. Question 21. Which structure in the urinary system carries urine from the bladder to the outside of the body? A. Ureter. B. Sphincter. C. Nephron. D. Urethra. Correct answer is D. The urethra is the tube that transports urine from the bladder. Ureters carry urine from the kidneys to the bladder. Nephrons filter blood to form urine, and sphincters control urine flow.
Question 22. Atrophy is a condition in which A. Bones become brittle, B. Muscles waste away or decrease in size, C. Joints become inflamed, or D. Skin becomes thin and dry. Correct answer is B. Atrophy refers to the reduction in size or wasting of muscles due to disuse, aging, or disease. Bone brittleness, joint inflammation, and skin changes are separate conditions and not considered atrophy.
Question 23. What is the function of the pituitary gland? A. Controls basic life functions like breathing. B. Produces insulin to regulate blood sugar. C. Regulates other glands and releases growth hormone. D. Directs white blood cells to infection. Correct answer is C. The pituitary gland is often called the master gland because it controls other endocrine glands and releases hormones like growth hormone. Breathing is controlled by the brainstem, insulin is produced by the pancreas, and white blood cells are directed by the immune system.
Question 24. What is the basic functional unit of the nervous system? A. Brain, B. Lobe, C. Neuron, D. Synapse. Correct answer is C. Neurons are specialized cells that transmit electrical signals throughout the body, forming the foundation of the nervous system. The brain is an organ made of neurons. Lobes are sections of the brain, and synapses are the connections between neurons. Question 25. The movement of a body part away from the midline of the body is called A. Abduction, B. Flexion, C. Extension, D. Adduction. Correct answer is A. Abduction moves a limb or body part away from the body's midline. Flexion decreases the angle between body parts. Extension increases it. And adduction moves a limb toward the midline. Question 26. Which body system provides a framework for support and protection, produces red blood cells, and works with the muscular system? A. Circulatory system, B. Skeletal system, C. Muscular system, D. Nervous system. Correct answer is B. The skeletal system supports the body, protects organs, produces red blood cells in the bone marrow, and works with muscles to enable movement. The circulatory, muscular, and nervous systems serve different primary functions. Question 27. A CNA is caring for a resident with congestive heart failure. Why is it important to monitor their fluid intake and output? A. Resident is at risk of dehydration. B. CHF causes the kidneys to produce too much urine. C. To ensure they are getting enough calories. D. The heart cannot pump efficiently, leading to fluid buildup. Correct answer is D. In CHF, the heart struggles to pump blood effectively, which can cause fluid to accumulate in the lungs and body tissues. Monitoring fluid intake and output helps prevent dangerous fluid overload. Question 28. Which of the following is a primary function of the lymphatic system? A. Transport oxygen to tissues. B. Defend the body against infections. C. Digest and absorb nutrients. D. Produce hormones for growth. Correct answer is B. The lymphatic system helps protect the body by filtering lymph and producing white blood cells to fight infection.
Oxygen transport is handled by the circulatory system, digestion by the digestive system, and hormone production by the endocrine system.
Question 29. Which organ is the primary site for absorption of nutrients into the bloodstream? A. Small intestine. B. Large intestine. C. Stomach. D. Liver. Correct answer is A. The small intestine has a large surface area with villi and microvilli that absorb nutrients from digested food into the blood. The large intestine absorbs water. The stomach breaks down food, and the liver processes nutrients but does not absorb them directly. Question 30. What is the name of the structure that prevents food or liquid from entering the trachea during swallowing? A. Epiglottis. B. Pharynx. C. Larynx. D. Esophagus. Correct answer is A. The epiglottis is a flap of cartilage that covers the trachea while swallowing, directing food and liquid into the esophagus. The pharynx is the throat, the larynx contains the vocal cords, and the esophagus carries food to the stomach.
Question 31. Which type of muscle is found in the walls of internal organs and is controlled involuntarily? A. Cardiac muscle. B. Skeletal muscle. C. Smooth muscle. D. Striated muscle. Correct answer is C. Smooth muscles are found in organs like the stomach, intestines, and blood vessels and work automatically without conscious control. Skeletal muscles are voluntary. Cardiac muscle is specific to the heart, and striated muscle is another term for skeletal muscle. Question 32. Homeostasis refers to A. A breakdown of body tissues. B. The body's ability to maintain a stable internal environment. C. A state of disease. D. The process of aging. Correct answer is B. Homeostasis is the body's process of keeping internal conditions like temperature, pH, and fluid balance stable despite external changes. Tissue breakdown, disease, and aging are separate processes and not definitions of homeostasis. Question 33. What is the primary function of white blood cells? A. To carry oxygen to body tissues. B. To help with blood clotting. C. To fight infection and protect the body from disease. D. To regulate body temperature. The correct answer is C. White blood cells are a vital part of the immune system and help protect the body from infections. They identify and destroy harmful organisms, such as bacteria, viruses, and other foreign substances. Carrying oxygen is the role of red blood cells, and clotting is the function of platelets. White blood cells focus only on defense and immunity. Question 34. Which of the following is a normal change in the integumentary system, skin, due to aging? A. Skin becomes thicker and more elastic. B. Oil and sweat glands become less active. C. Blood flow to the skin increases. D. Hair becomes thicker and darker. Correct answer, B. As people age, oil and sweat glands produce less secretion, causing the skin to become drier and more fragile. Skin actually becomes thinner and loses elasticity, not thicker. Blood flow to the skin decreases with age, and hair typically becomes thinner and lighter, not thicker and darker.
Question 35. Which part of the nervous system is responsible for involuntary functions like digestion and heart rate? A. Central nervous system. B. Autonomic nervous system. C. Somatic nervous system. D. Voluntary nervous system. Correct answer is B. The autonomic nervous system controls involuntary body functions such as heart rate, digestion, breathing, and blood pressure. These processes occur automatically without conscious control. The somatic nervous system handles voluntary muscle movements, while the central nervous system consists of the brain and spinal cord and does not specifically control involuntary actions.
Question 36. What is the main function of tendons in the musculoskeletal system? A. To connect bone to bone. B. To connect muscle to bone. C. To produce red blood cells. D. To protect the spinal cord. Correct answer is B. Tendons attach muscles to bones and allow movement when muscles contract. Without tendons, muscles would not be able to move the skeleton. Connecting bone to bone is the role of ligaments. Red blood cells are produced in bone marrow, and protection of the spinal cord is provided by the vertebrae.
Question 37. The diaphragm is involved in which bodily function? A. Digestion. B. Urination. C. Circulation. D. Respiration. Correct answer is D. The diaphragm is the primary muscle used for breathing. When it contracts, it moves downward, allowing the lungs to expand and fill with air. When it relaxes, air is pushed out of the lungs. It has nothing to do with digestion, urination, or circulation. If you pick anything other than respiration, you're confusing body systems. Don't do that on the exam.
Question 38. A resident with dysphagia has difficulty with which of the following? A. Walking. B. Speaking. C. Swallowing. D. Hearing. Correct answer is C. Dysphagia is the medical term for difficulty swallowing. It affects a person's ability to safely move food or liquids from the mouth to the stomach. This condition increases the risk of choking and aspiration and requires careful monitoring during meals.
Question 39. Which organ is responsible for producing bile to help break down fats? A. Stomach. B. Pancreas. C. Liver. D. Gallbladder. Correct answer is C. The liver produces bile, which helps break down and digest fats in the small intestine. The gallbladder does not produce bile. It stores and concentrates bile made by the liver. The stomach and pancreas have roles in digestion, but they are not responsible for bile production. Question 40. Which of the following is an example of a voluntary muscle movement? A. The beating of the heart. B. The movement of food through the intestines. C. Reaching for a glass of water. D. The dilation of the pupils in the dark. Correct answer is C. Voluntary muscle movements are actions that are under conscious control and involve skeletal muscles. Reaching for a glass of water is a deliberate action controlled by the somatic nervous system. The heartbeat, intestinal movement, and pupil dilation are involuntary processes controlled automatically by the body.
Question 41. You are helping a resident with heart failure get dressed. You notice that their shoes are much tighter than yesterday and their ankles look puffy.
What should you do? A. Tell the resident to drink more water. B. Put the shoes on anyway and document it later. C. Report the swelling to the nurse immediately. D. Ask the resident to walk around to reduce the swelling. Correct answer is C. Swelling in the ankles, edema, is a common sign of fluid retention in residents with heart failure and can indicate a worsening condition. A CNA must promptly report any new or increased swelling to the nurse. Giving advice, ignoring the symptom, or encouraging activity is outside the CNA's scope of practice and could put the resident at risk.
Question 42. While giving a bed bath, you notice a small pale or reddened area on a resident's coccyx, tailbone, that does not go away when you reposition them. What is your next step? A. Massage the area to increase blood flow. B. Apply a heating pad to the area. C. Position the resident so there is no pressure on that area and tell the nurse. D. Wash the area with extra soap. Correct answer is C. A persistent reddened area on a pressure point may indicate the beginning of a pressure ulcer. The first step is to relieve pressure and report it to the nurse so proper assessment and care can be provided. Massaging, using heat, or scrubbing can damage the skin further and worsen the condition. Prompt action prevents complications.
Question 43. A resident with diabetes is suddenly acting confused, is sweating heavily, and appears shaky. What is the most likely cause? A. High blood sugar, hyperglycemia. B. Low blood sugar, hypoglycemia. C. A normal sign of aging. D. Lack of sleep. Correct answer is B. Sudden confusion, sweating, and shakiness are classic signs of hypoglycemia in a diabetic resident. Hypoglycemia occurs when blood sugar drops too low, which can be dangerous and requires immediate intervention. Hyperglycemia develops more gradually, and normal aging or lack of sleep do not cause these sudden severe symptoms. Question 44. You are assisting a resident with COPD, a lung disease. They are on oxygen. They ask you to turn the oxygen flow up because they feel a little short of breath. What is your response? A. Turn the dial up slightly as they requested. B. Tell them you are not allowed to adjust oxygen and call the nurse. C. Turn the oxygen off to see if they improve. D. Tell them to take deep breaths through a straw. Correct answer is B. CNAs are not authorized to change oxygen flow. It can be dangerous, especially for residents with COPD, who may rely on precise oxygen levels. The correct action is to notify the nurse immediately so the resident can be safely assessed and treated. Adjusting or turning off oxygen without proper orders can cause serious harm.
Question 45. You are helping a resident eat when they suddenly start coughing weakly and making a high-pitched wheezing sound. They cannot speak. What should you do? A. Give them a drink of water to wash the food down. B. Hit them on the back 5 times. C. Start the Heimlich maneuver, abdominal thrusts. D. Ask them to go lie down. Correct answer is C. The resident is showing signs of choking with a complete airway obstruction. The Heimlich maneuver is the correct emergency action to dislodge the object. Giving water, hitting the back randomly, or lying down can worsen the obstruction and delay life-saving intervention. Immediate action is critical.
Question 46. A resident with osteoporosis falls in their room. They say they feel fine and want to get up. What is your first action? A. Help them up to the bed immediately. B. Tell them to stay still and call the nurse to assess for fractures. C. Give them their walker and let them stand up on their own. D. Check their pulse and leave the room to get help. Correct answer is B. Residents with osteoporosis are at high risk for fractures even from minor falls. Even if they say they feel fine, they may have internal injuries or broken bones. The CNA's first responsibility is to keep them safe and notify the nurse before attempting to move them. Helping them up or letting them stand could cause serious injury.
Question 47. You are measuring the urinary output of a resident with a catheter. You notice the urine is very dark, cloudy, and has a strong odor. What does this suggest? A. The resident is drinking too much water. B. This is a normal change with aging. C. The resident may have an infection or dehydration. D. The catheter bag needs to be changed. Correct answer is C. Dark, cloudy urine with a strong odor is often a sign of a urinary tract infection, UTI, or dehydration. Overhydration would produce very light or clear urine, and aging alone does not cause these sudden changes. Question 48. The integumentary system consists of which of the following? A. Brain, spinal cord, and nerves. B. Bones, cartilage, and ligaments. C. Skin, hair, nails, and sweat glands. D. Heart, arteries, and veins. Correct answer is C. The integumentary system is made up of the skin and its appendages, including hair, nails, and sweat glands. Its main functions are protection, temperature regulation, and sensory perception. The other options describe the nervous system, musculoskeletal system, and cardiovascular system, which are separate body systems. Question 49. Which part of the heart pumps oxygen-rich blood to the body? A. Left ventricle. B. Right ventricle. C. Left atrium. D. Right atrium. Correct answer is A. The left ventricle is the strongest chamber of the heart and pumps oxygen-rich blood into the aorta, which carries it to the entire body. The right ventricle pumps blood to the lungs, and the atria receive blood rather than pump it out. Question 50. Which part of the brain controls balance and coordination? A. Cerebrum. B. Brainstem. C. Hypothalamus. D. Cerebellum. Correct answer is D. The cerebellum is responsible for maintaining balance, posture, and coordinating voluntary movements. Great job finishing all 50. If these questions helped you feel more confident, hit that subscribe button and join our community at CNA Practice Lab. We're here to help you ace your exam and start your career. I'll see you in the next practice session.